I would have these really big outbursts, and they would be terrifying things like grabbing knives and like threatening to hurt myself, and a lot of like running into the streets. And so I got sent to Rainbow Baby Psychiatric.
You've arrived at the Mental Health Spotlight podcast with therapist Kais.
So you and I have an interesting how we met, and some of this might be in the intro, but we met at the Nita Walk.
Yes.
You were coming in for your first time, right?
Yeah, my first time.
And I think we talked for about 3 minutes, and I decided that you would be a great interview because you had so much to say and so vibrant and passionate about it. So I thank you for coming here and sitting with me and being willing to talk.
Of course.
Yeah. So I think to get started, and this will help me too, tell me a little bit about your story. I know you've got a lot. Maybe just some highlights to when this all began for you. And I think you have both the eating disorder story and probably a mental health story in there too.
Yeah.
Do you mind just kind of sharing
Of
some
course,
of it? And
if
we need to breathe and take breaks, let me know.
Yeah. Okay, let's see. So, oh my gosh, it is very complex of how it all started. It actually was triggered by a panic attack. I didn't know what a panic attack was, and I had a really physical, severe panic attack. I was 11, and I was at a rehearsal for a concert that was coming up.
Like at school?
No, it was actually with Apollo's Fire. My mom is a musician, so I was tagging along. Yeah, she's a singer.
I have so much to learn about you. But anyway, back to the panic attack.
Yeah,
At 11, by the way. That's horrible.
It was terrifying. So, I stood up. All of a sudden, my hearing went out. I couldn't see. It was just this, I didn't know what was happening to me. And my first immediate thought, because I grew up with allergies, was, oh my gosh, I'm having an allergic reaction. My throat is closing. And I already had this intense fear of having an allergic reaction. But since that panic attack, the fear just grew and grew. And I developed this insane fear of anaphylactic reaction.
Had you had an anaphylactic to begin with?
Never.
You just knew what it could look like, and so you had that building fear.
Yeah, so I was terrified, and because of this panic attack that I thought that I was so sure that this is what was happening, I became terrified, and so I avoided food, especially, it started first, I would just avoid the foods I was allergic to, but then it went to, oh my gosh, all these foods, and then it went to, oh my gosh, I can't even brush my teeth, what if there's cross-contamination with the toothpaste?
What were your allergens? Now, I'm just curious.
Yeah, so I was allergic to, growing up, I had a lot of allergies when I was a baby, but at that time, I was allergic to eggs and nuts. And
I have a client who gets anaphylactic with eggs, and it is a very tough one to avoid. And client, you know who you are out there.
The crazy thing is now, though, I tested, and I'm good to go with eggs. Something I never thought I would have been able to do, test for.
Really?
Yeah.
I wonder if she should. She's older than you. She's second year college.
Yeah. I mean,
totally
it's
offshoot, but hey.
Yeah, I mean, it opened up. I'm going to take my gum out. Sorry.
We didn't talk about gum ahead of time. That's okay, because I'll be drinking my coffee here too the whole time. I didn't even notice you had gum in your mouth. You're very good at it. So you had this fear that was valid to begin with, but then it grew into something else.
It grew into something so obsessive, and it honestly, my parents were like, what is happening? What is wrong? Why is she so terrified of this one thing, and it's so specific, it's so, rigid. And so we went to my grandma's for Christmas to celebrate, and I just remember spending the entire time in the room I was staying, and I was terrified. I was just crying. I felt so lost because it'd been a few days, and I was barely eating, and I was starting to feel sick physically, but I didn't know what was happening with me. I think the worst part then, I don't necessarily think it was even the fear that was the worst part. I think the fear was what is happening to me? I had no idea what an eating disorder was. I had no idea any of this. I didn't really know about mental health challenges, so I was like, what is going on with me? And
so you just woke up, this panic experience kind of woke you up.
It just flipped a switch.
Wow. But stuff was already happening, and this was sort of the thing that made it obvious.
Yeah.
Wow.
And I was so confused. I didn't understand what was going on. And my parents didn't either. We did research. They were frantically looking for answers. They were.
And I'm going to interrupt you for a second. So you said you were 11. How old are you now?
I'm 17.
You're 17. So this was 6 years ago.
Yeah.
Okay. That just kind of gives me a sense of how much the world 6 years ago may not have been paying as much attention as it is now. And that was before COVID.
Yes.
But you'll go into that.
Yeah,
okay.
That's a whole thing.
I got to get the frame of reference on time there.
So my parents were doing all this research. There's something called PANDAS, which is like a, have you heard of that?
Vaguely.
Yeah, so my mom was like, is your handwriting like she was asking all these questions. We were honestly desperate at this point.
So you weren't necessarily just looking into mental health. You were looking at
Yeah.
your physical health, like the allergens, but
Yes.
also some other developmental stuff.
Because we knew what an eating disorder was. Well, my parents did, I didn't yet. But they weren't as educated, like, as much as, I guess, definitely not as much as they are now. But they just didn't know much.
What were you doing at the time? That because you mentioned I went from this panic moment. That's what brought everything forward. But there must have already been some restricting type behaviors. What were you doing at 11?
Well, so the thing is, it had always been anorexia for me, but the ARFID, I got an ARFID diagnosis with the fear of anaphylaxis. The ARFID diagnosis was almost like a way to cover it up. It was kind of like I didn't want to accept that I didn't like my body and that I was afraid of gaining weight, because I thought that was stupid, and I thought that having a fear of an allergic reaction was also, frankly, stupid, but I guess that resonated more with me because I was so young. I thought my parents would believe that more, maybe, in a sense. And because I actually had a past with allergies, I never had a past with, like, being overweight. So it was like this, like, what if, like, I didn't want to accept it myself. So I didn't really, like, verbalize that because I just didn't even believe it myself. So
Did ARFID feel safer then because it felt more related to your allergens?
My age
and
everything.
It was like a softer vibe for it.
It felt, definitely.
Interesting. But you noticed from the beginning that the anorexic brain, if you will, was already in there.
Yeah.
And ARFID probably was too. I think the ARFID was valid.
Yeah.
But you must have felt so invalidated just in the language you had in your own head that, you know, these aren't, I shouldn't have this. This shouldn't be happening.
Yeah.
That's tough.
And, so yeah, there was a lot of, I mean, I'd always really had bad body image since I was 7. I would always, like, there was a lot of body checking in,
At 7?
7, yeah. I would do a lot of, like, I would look back at photos and be like, oh my gosh, and compare to how I was now, or compare to when that photo was taken, and it was just, I mean, it was manageable until it wasn't, and then it took a turn, and it got really extreme really fast. So when
was that the 11? So from 7 to 11, it was sort of underneath the
it was
radar.
like hiding, and it was like peeking up and like sneaking, but like it wasn't there, like it wasn't as present.
And
but
you probably couldn't have defined it until you were 11, looking back, going, "Oh, there it is." I assume you figured these things out later.
Oh yes, like tons of the things I've been like looked back and like, oh wait, this is what actually was happening, and this is like how I was actually feeling. This was why my response to a situation was this. But so I had another panic attack, and so many panic attacks. I got sent to the ER because we didn't know if it was like something physical, because it was like I would like get really physical symptoms, and my mom was like, is something wrong with her heart? Like, we didn't know. They just kept like referring us back to like therapy stuff, so I went through a bunch of therapies, but then after this point during...
Was this outpatient therapy, Luisa? So your parents are taking you, someone like me, going to talk through it. But you weren't getting, at that point, were they dealing with the panic and not seeing the eating disorder yet? Got it.
Yeah.
Now I'm seeing how this all played out.
Yes. So then once I got sent to a hospital. My grandparents live in Chicago, and I got sent to the ER in Chicago, and they took my weight, and my mom's reaction was like, oh my gosh, it's only been 4 days.
Were you visiting Chicago? How'd you end up in Chicago?
Yeah, we were visiting Chicago just for Christmas.
Yeah.
So we drove there, and I was already struggling, but we were like, oh, maybe like the fun holidays with my grandparents. I love them so much. It'll be like such a good experience. Yeah. But I couldn't enjoy the fun experience because it was so miserable, and I was terrified to eat. I would wake up in the middle of the night so hungry, and I'd be like, Mom, I'm so hungry, but I just could not eat. I was too scared. We would have times in the middle of the night at like 2 a.m. where we would try some food, and I just couldn't do it. Like, I just could not get that bite into my mouth.
So this all bubbled up into a kind of waiting to burst, and then when you're in Chicago... Did something happen to send you to the ER?
Yeah, so I had a really extreme panic attack, and we drove to the ER because I hadn't eaten like barely anything in a few days, and my mom, she was on the phone with the doctor, and she was like, I don't know, like, my child's not going to live much longer if this continues. I don't know what I'm supposed to do.
Right. So she was right to check and find out.
Yeah, she was always very on top of things, even though sometimes she's like, I feel like I could have done something more. She was always very much on top of things.
Well, you said it yourself. We don't know what we don't know.
Exactly.
Like, she
exactly.
Wouldn't have known.
Yeah.
But she asked for help.
Yes.
Huge.
She asked for help, and we went there, and then they transferred me to Rainbow Babies. I was at the the GI.
So you were in GI.
Because they didn't know where else to put me.
They put you.
Yeah, they didn't know where else to put me because they didn't know what it was. They were talking, like, feeding tubes, all of that. But my sister was like, no, she can eat. I don't want to have to see her get a feeding tube. She, like, stood up for me. And
this was your twin sister, right?
Yeah.
I mean, your mom mentioned that. I
Yeah.
figured at some point that might be valid.
Yeah.
Not valid, relevant.
Yeah. I mean, later on, I had a whole situation with feeding tubes. But at this point, I was doing okay. I was not eating very much, but I was on IV fluids, and my heart rate, I was getting more medically stable, and so they sent me home after about a week, and I was really scared. I kind of liked the hospital in a sense because it made me feel safe because I was connected to all the monitors, so I didn't, like, have to worry about, like, oh, if my throat's closing, then they're going to be able to tell.
So it helped the panic side of things.
It did.
And were they feeding you there, or were you eating willingly at that
I was
point?
eating willingly.
So you're still 11, but you're in a medical setting now.
Right.
In the GI department
Yeah.
there. And eating something at least, because
Yes.
you felt safer.
Because I felt safer.
But no one at this point has dealt with your eating disorder yet. They're looking
Not
at
yet.
more like, we're not worried. They just want to get food in you.
Yes,
which
exactly.
Is fair.
Yes. So I was sent to the Emily program for day treatment.
Oh, wait, go back. So, well, that was a big jump.
Yeah.
So, an Emily program is our local eating disorder.
Yeah.
At several levels, including res. But so you're there. How did the decision then go from here's our little girl barely leaving the hospital to let's go to Emily program?
Okay. So before I was discharged from the hospital, we made a plan to get in contact with Emily program, and then I was diagnosed with ARFID.
Okay, so they were identifying it while you're at Rainbow
Right.
at some point. Okay.
But the interesting thing was, when I went for my intake at the Emily program, I forget his name, but he was, like, one of the higher positions up there. And he was like, no, she does not have ARFID. She has anorexia. She is typical anorexia. And my mom said, no, she doesn't. She doesn't even care about her body or her weight. She's just 11. And he was like, no, this is going to present as anorexia later on. And
wow, the insight that person probably had.
and it was because of all the symptoms of, like, OCD I showed, and all of the rigid, like, specific things, like, I needed, like, certain routines, and, like, I was very specific, and, like, it mainly had to do with the OCD things that I showed. So I spent a while, a really long time at the Emily program, and I missed...
You said you were in which program level were you at there?
Not the residential one, the one...
PHP? Like 6 hours a day?
Yes.
Okay.
Yes, PHP.
Yeah.
And so it was a while there. I had some negative experiences.
Well, you were 11.
Yeah.
I was still 11. So you're 11. Your whole world's upside down.
Yeah.
You've already had physical stuff going on. You've
Yeah.
been in hospitals,
Yeah.
which is traumatizing.
Yeah.
I'm sure you already have the medical trauma.
Yeah.
And then you go somewhere that doesn't know whether it's treating you for ARFID or anorexia.
Right. Yeah.
Because you were too young to say, no, I've really been thinking about my body. It doesn't
Yeah.
sound like you had that language then.
Yes, and then after they would ask me questions like, are you scared about your weight? Are you scared about gaining weight? And I'd be like, no, because even when I would say no, and when I would say, like, no, I'm not, I would believe it, and because I just wasn't ready to accept the truth. And eventually I was doing now just, like, therapy appointments and regular appointments because I was done with PHP.
You did the full however
yeah.
long. Did you drop down to IOP or just
Yeah.
go from... So you did the whole thing at 11, the whole program.
Right. But things got bad again, and I started exercising a lot in my room. And I remember there was one day, and I would throw away my lunches at school, and I would just not eat. And my teacher was like, hey, she's, like, finishing lunch really fast. I'm not sure if she's actually eating. And everyone was just, like, a little suspicious, but they, like, didn't want to have to believe that I was going backwards. And so I was upstairs in my room one day, and I was exercising, and I was doing, like, the sit-ups and everything, and then my sister comes up, and I frantically run to, like, hide, and I'm like, I was thinking, why am I trying to hide this? Is my intention to lose weight? And I was like, yeah, my intention is to lose weight, because I feel insecure about my weight, because I had to gain so much at the Emily program. And I wrote my mom a letter, and I said, Mom, I think I have anorexia, and I brought it down to her right before dinner, and I handed it to her, and she goes, I know. And she gave me a hug, and we sat down at the dinner table, and it was quiet, and my sister goes, what's going on? And my mom goes, what do you think is going on? Like, what do you think, what do you feel in this moment? She was trying to talk to her because my sister knew that something was up. And my sister goes, I think Luisa has anorexia. And we all just knew. Like, they knew, even if they didn't want to accept it. I certainly didn't want to accept it, but we all kind of just knew.
And you had a label. And I love something you said there. And you were so young to have that insight. You were what we call intention setting. We talk about it here all the time. You knew your intention was not, I'm just going to do some sit-ups.
Yeah.
You knew the disorder in it. You could recognize it that young. Enough to say to your family, I know what this is.
Yeah.
That's a big moment.
It definitely was.
Brave moment.
Yeah. And after that, we talked to my doctors. They were like, yeah, we kind of knew. That's kind of what we expected for how it would play out. And
Can I ask a quick question for Luisa? So when you were in Emily program, what track were you on? Were you on the ARFID track or the or did they have both at the time?
So I ended up going back to the Emily program for anorexia later.
So you did go on an ARFID track when you went the first time?
Yes.
Because I do recall, as long ago as you were there, they didn't have, at the time, a very solid ARFID program.
Yeah.
Because it was still new to them.
Yeah.
They probably, no offense to them, I'm not here nor there with them, but they probably didn't have a great program anyways for that.
Yeah.
But then you had to go back to actually talk the real talk.
Yeah.
With what you were finally being honest with yourself
exactly.
about. And you'd be amazed how often I hear this now. Now, that's not, one way or the other. It's anorexia where we don't identify the ARFID.
Yeah.
Or ARFID where all of a sudden you're like, no, wait, really?
Yeah.
The anorexic brain's
Yeah.
there too.
Yeah.
So you go back again. How old are you the second time?
Still 11.
Okay. This all happens pretty quick then.
Pretty quickly.
The family's quick.
Yeah.
Okay.
So, I was close to turning 12. And I think I was 12 as I was going through this process. My memory's a bit fuzzy from all of this with timestamps and everything.
You're doing a great job. I don't know how you can track all this.
Yeah, it's crazy how I remember very specific things and then less specific things. It's been interesting.
You're probably in a bit of fight or flight or crisis going through a lot of this, especially if you're undernourished.
Yeah, definitely. Yeah. And so I go back, get treated for this.
Would you go back to PHP again or a different level of care?
Same thing, went through the whole process again, but with treating anorexia this time.
Wow.
And we're working on meds, all of this stuff. Eventually, I work really hard to get out, and I'm doing great. I'm, at this point, 12, and I'm doing amazing. There's always that, like, oh, I have to leave school early because I freaking hate how I look, and, like, I can't stand this, and, like, I'm so uncomfortable in my body, just pick me up from school, I can't do this. So there was, like...
Some school refusal happened?
Yeah, a lot of school refusal. So 5th grade to 8th grade, really, I did not attend any school.
And that's
really.
such a nightmare. I shouldn't say nightmare. That's a really tough time anyways.
Yeah.
And here you were just coming in and out.
Yeah, definitely.
Did you get to keep any normalcy in that time, like with friends or groups or anything?
Not really, but
okay.
I would say honestly I kept more like genuine friendships and a little bit more real life when I was actually going through that stuff rather than when I got discharged from the hospital in Denver. Yeah.
Wow.
Yeah.
We're only a quarter of it. I like how I had that as like one section. That's pretty much the whole thing, right?
Yeah.
Wow.
Yeah.
So you're back at Emily and you do the whole thing again.
Yes,
but you did
I'm
the
out.
anorexic trial.
Yes.
Okay.
And I'm doing good.
Okay.
I'm
No
weight
behaviors
restored.
at that time?
No, I mean, it was more like I'm honest with my parents when I'm feeling the urges to have these behaviors.
Beautiful.
Yeah. And
Sounds like more subtle.
shortly I'm get this really strong urges every day to just not eat. And it becomes, I don't exactly remember the time it happened as I do for like when I wrote my mom the letter. Like I don't remember, it kind of just slowly happened. And so I began to just restrict. I would not eat lunch at all at school, and then I would throw out all of my food every chance I got. So the only
This is the third time this starts happening to you.
Yeah.
So every time you get into recovery, something's keeping you from sustaining recovery.
Yes.
Can I ask you a quick question
Yeah.
too? Were they treating the OCD? Because it sounds like the OCD was its own little thing. Is that fair?
Yes.
That's something you might always have to work on as a person. Okay.
And something I'll tell you about later on. We actually just figured this out. I am on Ritalin for oh my gosh, why am I like... Yes.
You're welcome.
Yes.
I was like, for the OCD?
Maybe. So we figured that, and I had a long talk with Dr.
You were never treated for ADHD before. And you have Dr. Janet Kemp, who's amazing.
Yes, love her.
She's so fun. She's sassy. She's sassy.
Oh my gosh, I know. But we figured out, she was explaining this to me, how that was a big component of why I refused treatment, which I'll talk about in a little bit.
Okay, the ADHD side.
Yes.
Of it. Okay.
Yes.
So we're looking back, but back then you were not necessarily treating
I
these
would comply.
other things that were
Oh
coming
yes,
into play.
yes.
There was other things happening that everyone just couldn't see because they were too busy trying to keep you alive.
Exactly.
Right.
Exactly.
So your leave there, you're starting to restrict again, and you're 12, probably later in your 12th year.
Yeah. So now I'm turning roughly about 13, and
And you're in puberty-ish.
Yep.
So that's got, or maybe, I don't know if you had early puberty, but that's
Yeah.
complicating things too, I
Yeah,
would think.
definitely. So every chance I'll get throughout my meals, throughout my snacks, supposed to have 3 snacks, 3 meals a day, would get roughly maybe 1 meal a day. And that would be dinner, because we would have a family dinner and sit down.
Because you're still Maudsley age then, your family's still in
Yeah,
charge.
exactly.
Yeah.
And so eventually things just go downhill, and they go downhill so fast. I mean, I dropped so much weight. I would get weighed at doctor's appointments. I remember I hadn't seen my doctor in a while because she was out, and I go back and she's like, Luisa? And she didn't recognize me. And I was like, yeah. Like, I didn't even notice how much weight I was losing.
Because, were you seeing a specialist for your for PCP? Was that someone your doctor was a specialist in
the doctor who worked with the Emily program, Dr. G. Gillespie.
Mm-hmm.
Yeah.
Yeah, got it.
And so I kept dropping weight. It just kept going down and down. And so eventually, I started, okay, this is a little complex. I started saying, like, I'm suicidal. I'm going to kill myself. Mm-hmm. And in that moment, that was my way of asking for help with my eating disorder, even though I wanted help with it, but I didn't at the same time. So I was like, let me get help with something else, and then they can help me with that along the way.
Because a part of you, and I might be speaking for you here,
yeah.
a part of you probably didn't want to get rid of the eating disorder. Because
yes,
you've known it since
exactly.
you were 11. It served some purpose.
Oh, yeah.
So you thought, but the depressed, and I'm assuming you're depressed too, if you're feeling that way. It was safer, in a way, to get help on that end. That's fascinating. But you had so much insight over this, don't you?
Yeah, it's been crazy how much insight I've gained.
Which I love that you're saying this out loud, because people are hearing this that maybe are at a stage where they don't have insight yet, and maybe this is sparking some thoughts in them too.
Yeah.
But continue. I keep interrupting
you.
There's
You're good.
So much going on
I know,
here.
it's so much.
We got to keep me clear.
So
you became some safety challenges. You were a safety risk.
I started just kind of, I would have these really big outbursts, and they would be terrifying things, like grabbing knives and, like, threatening to hurt myself, and a lot of, like, running into the streets. And so I got sent to Rainbow Baby Psychiatric. And
can we do another episode on medical trauma when we're done with all this? Great.
Definitely.
I don't think we have time to talk about the medical trauma.
Yeah, wow, it's a lot.
I'm surprised you want to come sit in here with me.
No, I really do enjoy doing this kind of stuff.
Good. Okay.
It's like,
it's not bothering
it's
you.
empowering. You know?
I'm not gonna. I have no needles. I have no lab stuff.
So.
But so you're in their psych department for just an evaluation, or did you end up staying there?
I ended up staying in the psychiatric unit. And they're
lovely people. It's just tough at
they
your
also,
age to be there.
a lot of them didn't know much about eating disorders, and they thought I was there for, like, they knew about my history, but they were like, oh, she's saying, like, she's suicidal, because that was what they had during the evaluation. And I was suicidal, but it was more of the eating disorder struggle. It was the eating disorder that was making me want to end my life. And so it was hard. It was, like, all connected. And
they didn't have the capacity to, and that's also a hospital setting. That's not what they can do.
Exactly.
By the way, you'd love this. So we do a lot of training here for fellows who are in psychiatric fellows as well as medical, to teach them about eating disorders. Yeah. Because they don't learn enough. Yeah. And that you're a testament to that. Yeah,
definitely. And I remember there were I have so many stories. That's a whole other thing, from treatments and hospitals and all that. I remember I got my my second feeding tube placed at the psychiatric ward, because they, like, which usually it was odd. They did at the psychiatric ward because it was like they needed to do it right then and there.
And that was your second, so at some point you had an NG tube before then?
Yes.
Okay, so somewhere along
just
the line.
Just like put it in, bolus, and then pull it out.
Okay.
Just because I had restricted for 24 hours, so it was just like a protocol.
I'll keep you safe. And when you're young and you're not of age, really, they just kind of do it.
Yeah.
So you're in the psychiatric ward, having all these intrusive thoughts, and you're getting a tube.
Yes. And
were you taking SSRIs and stuff at the time? Were you taking medication for your mood?
I was on a lot of medication.
You probably were. Okay.
I was heavily drugged. I felt so out of it. I was like, life did not feel real. I felt like I was in a dream, a nightmare rather. But
was that keeping you safe at all? Because the idea, I think, was to sedate you enough to not have you feel so impulsive.
Yeah. Okay. Yeah, it was.
It kept you maybe alive, but it wasn't a long term.
A lot of it was sedatives, like through shots, when I would act out. So that was a bit hard.
We're gonna make a movie about you.
Yeah. There was one boy, he was 8 years old at the psychiatric ward, and he came up to me and he saw my feeding tube and he goes, oh my gosh, the aliens, they're consuming you, they took your life away from you, they got you. And I was like, yeah, they did actually.
Wow. You could connect with his place in reality with what you've been through.
Yeah. So he was obviously had these some sort of like thoughts or visions or something, and he was just like, yeah, they took you, they're consuming you. And I was like, honestly, buddy, they are.
That eating disorder's got me.
Yeah.
Yeah, that's interesting.
Yeah, but so after, oh my gosh, here's the whole journey. After Rainbow Baby Psychiatric, I lost a lot of weight because I wasn't eating. So they sent me to, this is the one hospital, I don't remember what the name was, but it was here, and it was a medical, like for medical.
Okay.
And so there,
it was like a feeding clinic idea?
Yeah.
Okay.
So there was a lot of like hard, like they would restrain a lot and like sedate, and like this was at the point where I'd never been force fed yet, but they would threaten it a lot of the time, and that was enough to be like, okay, I need to eat, I'm not getting force fed.
And that was 4 or 5 years ago.
Yeah. But so it was just, I went through a lot of like restraining with police and a lot of staff members and nurses, and then like getting the shots and feeling like waking up and being like, where am I, and like all of this stuff.
So your behaviors were also
oh my gosh,
you were like in a corner coming out fighting.
I was so stubborn. I was so verbally aggressive. I mean, you wouldn't have recognized me physically, but you would not have recognized me like who I actually was. Like I was a completely different person. And
which is so common.
Yeah.
Not only with some of the stuff you're dealing with mental health, but with eating disorders.
Yeah.
And it really does affect your brain for a period of time.
Yeah.
And it changes so much that you probably didn't look like yourself at all.
Yeah.
Like you said, the presentation of yourself.
Yeah. So there was a lot of things where I would just have these really scary experiences, lots of outbursts. There was a time where I reached for a police's gun and got immediately sent back to psych.
I'm gonna do it.
Yeah.
But you were desperate.
I was really
That's
desperate.
That's a really desperate, scary thing to do at that age. What a tough place you were in.
Yeah. And so I got sent to Fairview Psychiatric. This is all within like one after the other, no home. This was right around the holidays.
No wonder you stayed dysregulated.
Yeah. And so Fairview, spent some time there. They had a restraint chair and a restraint room, and that was really traumatizing for me.
And your panic.
Yeah.
Because that still hasn't been treated. I'm assuming from what you've told me, we've got the OCD, the anxiety, the ADHD, the panic, all that, and now you're being tied down in an unfamiliar setting.
And they were confused. Why is she so aggressive? Why is she so stubborn? Why won't she comply? And the way they approached certain situations motivated me not to comply, because it was like, oh my god, hands on, like I can't do this, I'm gonna like freak out and just like get away as fast as I can. So there was a lot of like attempts to run away, and a lot of I don't know, it's just the restraint room with the restraint chair. That is one place that like really haunts me, because I remember just like being dragged across the floor and just put into that chair and just locked up. And there were times where I remember there was this one time I was screaming, I'm not psychic, and the people started laughing at me. And they were like laughing at me, and I got angry. I was so angry. I was like, why are you laughing at me? I was so mad all the time.
What do you think, that just because that's such a visual, and we've seen it in the movies, and you saw it in your real life, the reason, of course, is so you don't hurt yourself or others.
Right.
And sometimes restraints are necessary.
Yeah.
But what do you think they could do different? I know that's a big, chunky question, but what would have made it less traumatizing for you?
So I've thought about that a lot, and I think it really depends on each individual patient, because some truly just need to be restrained. Okay. Others can be talked out of it. It depends on the state they are at. And sometimes I could be talked out of it, sometimes I couldn't. I think a lot of the situations where they would restrain me felt a little bit unfair, because it would be like I was exercising and they're like, off to the restraint room. Because they knew my history with not complying, it was automatically like, we're not even going to try. And so that became a thing that was really frustrating for me, but I just didn't see that that's what they were doing. I didn't see the thought and intention behind it. So I got really angry.
I wonder, I think about those settings, and I've worked in schools where, not necessarily that kind of restraint, but you have to keep people safer, and community mental health. And I wonder if you had like what's called like a snoggling room, if you had like this sensory room, and you were able to put them in this sensory deprivation with the sounds and I don't know, I mean, maybe you would trash it, but I wonder if that approach would help for some.
I definitely think it would, and I definitely think that I know for me, a lot of my experiences had no warning. I was just brought there immediately, and I think that's some sort of warning, like, hey, this is what's going to happen if you can't comply. Or, okay, you have this amount of time, otherwise we're going to have to take you off to the restraint room.
There should have been. I mean,
Yeah.
the proper protocol would have been for you to. And maybe you
Yeah.
didn't hear it. Who knows?
Who knows? I was in a crazy headspace. So.
But no matter why or what, you're still stuck in part of your healing on your recovery journey is healing from that too.
Yeah. Oh, definitely. Yeah. So it's just.
So that was still in Ohio here. That wasn't.
Yeah.
I know you mentioned Denver.
Yeah.
At some point you ended up. I don't know if it was ERC or where you were over there in Denver. You went somewhere.
So I got after Fairview Psychiatric. I got sent to Fairview Medical Hospital because I had dropped a lot of weight again. And it wasn't like I ever really got weight restored during this time period. I just kept like hovering above like a certain number and then dropping down and then trying to get back up there and then back all the way down. So it was like not really I wasn't medically healthy or stable. So I got sent to the medical unit on Fairview and got my feeding tube placed, another one, and we kept that one in through until I was discharged, went home with the feeding tube because there was no other option.
All right. At least it kept you with sustenance.
Yeah.
Sorry.
So I would get my feeds at home, try to complete. I started seeing Dr. Rome.
I was going to ask if you had to end up in Dr. Rome's
Love Dr.
care.
Rome.
Yeah, that's our ED.
Yeah.
They're
So,
great. That whole team's great.
Yeah, we were doing feeds at home. I was having my outbursts, threatening once again, just being really not safe. At this point, I never actually struggled with self-harm. I would threaten it, but I wouldn't actually struggle yet with self-harm. When I was sent to ERC Denver.
So you were at ERC there?
Yeah.
You said Denver.
I was home for about, I don't even remember, kind of not too long. They got me admitted into Denver pretty quick. So I went to ERC Denver, and I was 13 at this point, and got admitted. They were like, average stay, probably 4 to 6 weeks. About 5 months later, I left.
Well, you needed something pretty long to make
Yeah,
up for all the choppy stuff.
Exactly.
But you're away from home this whole time.
Yeah,
At
and it was during
13.
COVID, so my parents weren't allowed to visit. And
I don't have enough training for your trauma. Oh my gosh.
Yeah, it's a lot.
Wow.
So,
But it hasn't broken you.
no.
We haven't even got there yet, but
Yeah,
I can tell
yeah.
it hasn't broken
No,
you.
I think
'Cause
it's made me
you're holding it
stronger.
a little lightly. I mean, it's not funny. It's not
Yeah.
light, but you're holding it light. You're like,
Yeah.
man, this happened, but check me
Yeah.
out. And I overtook your voice there. You said it makes you stronger.
Yeah, definitely. Yeah,
Wow.
I think that all of this experience, it's been, I mean, there were moments where I was like lying on that hard, cold floor of ERC, just like so helpless, laying next to like a pile of throw up that I had just vomited because I felt so full from my feeds and I couldn't keep it down, and just feeling like I'm not gonna get through this. Like, there's no point. Like, I don't even know how to describe that level of hopelessness. It is so, like, I don't even know how to describe it. It's too much to describe. And I remember listening to my MP3 player with my headphones, listening to songs that were just brought me back to hard times from when I was struggling back at home, and songs that reminded me of my family, and I felt so sad. I was like, I need my mom, and during that time, I had to earn my phone calls, so I wasn't allowed to talk to my parents unless I complied or I finished all of my meals, or I didn't self-harm for 2 days, and at that time, that wasn't really something I was capable of doing, and I just needed, I just needed my mom. Like, I just needed her in that time. I was 13, I wasn't
Maybe it wasn't the right thing to use as a reward.
Yeah, definitely
There's
not
other
for me,
things.
yeah.
You're so alone.
Yeah, so I was feeling really hopeless, and
was your depression being treated, or was that still...
I was on medication for that,
Yeah.
but the eating disorder was so extreme that they were like, let's focus on this, and then we can focus on all that.
And you're a couple of years into something that you keep trying to fight, and it keeps
Yeah.
coming back and punching you down.
So it would just, I would have good days, and then I would have bad days, and then I would have horrible days. And there were times where I remember my first force feeding experience there was so traumatic because all these
Is this
people...
outside of the tube? Like they actually force feed
No,
you?
this was with the tube.
Oh, with the tube. Okay,
Yeah.
I think that's the way we do it.
Yeah,
now.
yeah.
It's still forcing.
Yeah, and these people that I trusted from my team at ERC they brought me to the exam room. I hadn't eaten in 3 days, and I hadn't drinking water in 2 days, and I was a water restrictor as well. So I didn't eat food, but I was terrified of water too. So I would go days without drinking water, and that was like, oh, we need to do something about that.
Your numbers were tanking.
Yeah. So they took my blood sugar. It was low. I kept I was passing out. So they were like, we got to do something about it. And I feel like
outside of your right then. I mean, they have to.
Yeah. And I tell myself later, I'm like nowadays, I'm like, I should have known that this was coming. Like, I should have known that they were going to do this. But honestly, I was so, disassociated from reality that there was no way for me to know what was coming next, or what was going to happen.
You couldn't have had that insight with all that malnourishment.
Yeah.
The brain itself couldn't have done it.
Yeah.
You were surviving.
Yeah.
That's it.
So, I remember...
So then and that's a good point then. Then someone comes to you with this intervention, and you're all like, you can't make sense of where it's coming from.
Yeah. And I remember I sprinted, and I go hide under this desk at S3, nursing station 3, and I'm sitting under there shaking and just holding my curled up in this little position, just shaking my legs, and I start self-harming, and I start scratching my arms, and I'm freaking out. I'm hyperventilating. They come over, and it was 8 adults, and it seemed like they had this whole routine. The one I trusted the most, my dietitian, she cradled over my lap like this, and another dietitian did the same. So she was going this way, the other one was going this way. They were kind of just both hovering over my lap. And then someone else pulled me up, picked me up, and dragged me across the floor, and then held my head when I started covering my nose and my mouth. And they grabbed my hands, and they just kind of restrained me down to the ground. And then the nurses, I remember, they got the tube and they started putting it in, and I started gagging because I was distressed, and it's already an uncomfortable procedure.
And it doesn't work when you're tense.
Yeah. And so I remember the nurse said, "Should I do some water too?" And they were like, yes, do water. So she bolused with those huge syringes a bunch of water, and then started in with the Nutrin. And it was just, it was so many syringes, and they did it in a matter, it felt 10 minutes, but it must have been very little, 2-3 minutes.
And how tough on your GI system.
Oh.
It's not like you were getting a slow 45-minute meal, 30 minutes. You were getting it thrown in immediately.
I, to this day, have GI stuff all because of that.
And other reasons, but having to force feed your stomach to survive is pretty intense.
Yeah.
Wow.
So, to this day, because of all my, restricting and everything, my stomach can't even, I have trouble with my stomach issues, but...
It'll take a while, won't it?
Yeah, same with heart issues, too.
Yeah. So some of these things don't just go away.
They linger on. Yeah.
Because you were so young.
Yeah.
Your heart muscle was still building.
Yeah, exactly. Yeah. So, they did that. I think the most painful part was after they were done, they said nothing. No words, got up and left. And I just sat there. I was like, what do I do now? They didn't talk to me. They didn't say, all right, well, if you need support, we're going to be over here. They just...
Was there a mental health professional there, or was it all medical at that point? Where was your social worker, your therapist?
My therapist was not there. There were BHCs, behavioral health counselors, who were helping out with it. But it was mainly nurses and then my dietitian.
So you felt alone?
I felt really alone. And I was really scared, so I tried to run away, because that was always my first go-to option, run away. Because I think in that moment I wasn't just thinking I'm running away from this place that terrifies me. I'm kind of running away from my issues and just kind of trying to avoid them. I'm running away from my reality. Yeah. And so...
but if someone had taken the time, I think what you might be not hinting, but what's in the background is someone had taken the time to talk with you about what was happening or try to soothe you. Yeah. I'm not feeling a lot of soothing in this. Yeah. I know they had to do it. Yeah. And we're not going to let you die. Yeah. But you didn't, it just sounds like you didn't feel any soothing or nurturing. Yeah. And we can do both.
I think I was such a complex patient that maybe they thought, how do we even do that? How do we even approach, a soothing tone with her? But...
Did you connect with your therapist, though? Was there a connection with any of them where they came in the room and you're like, okay, I trust you, come talk to me?
I loved my team.
Okay, especially, so you did have that.
Especially my dietitian, Miranda. I don't think she works at ERC anymore. I think she works with another person who was at... the Nita Walk knew her. What was...
From Denver?
Yeah, she works with, what was the other sponsor? They were next to you guys.
Equip or Emily program?
Yeah, Equip. Mm-hmm. She works with Equip now, I believe.
So you had some people that connected with you, but they're not necessarily there when the medical people come in, hold you down, and
Yeah.
I say medical people meaning the medical necessity was there. I
Yeah.
don't think they were wrong to do it, but maybe the how.
Yeah,
The how-
definitely.
and how do you do that nicely?
Yeah.
How do you hold someone down who's trying to self-harm?
And it was just, I
During
mean,
COVID.
Yeah.
Do you remember this?
Yeah.
And everyone's tense and angry and
people got
overworked.
COVID and then got sent out, and I was so scared I was going to get COVID and kicked out. I did end up getting kicked out of the hospital. Because my insurance couldn't pay for it anymore because I'd been there for 5 months, and my insurance was like, oh, she's not getting better. What do we, like, at this, like, when I got kicked out, I was pretty much medically stable and basically weight restored, but my mental health was still not good, and
It takes so long. The brain comes way later.
Yeah.
You get the body, now
Yeah.
you get the brain.
And I think the interesting thing is that I learned from well-being, especially at ERC Denver, I went in with a really big issue surrounding one thing, which is my eating disorder. I came out with so many other issues, and I don't think that's necessarily because of ERC Denver. I think part of it was the environment I was in. I mean, these patients, I picked up on self-harm because of other patients having self-harm, like, behaviors in front of everyone. I picked up on a bunch of other behaviors from
It's
like
hard
a bunch
not
of
to be in a suggestive environment.
Yeah.
And that's why we try really hard not to send young people to residential.
Yeah.
But
We tried for a while, yeah.
I'm sure your parents
Yeah.
went kicking
Oh,
and
yeah.
screaming, but they can't treat you at home.
Yeah.
What were they going to do?
I was actually, when I was at Rainbow Babies for the first time with the GI unit, they wanted to send me to the Emily Program Residential, but my parents were like, let's do everything out of our power, like, to not do that.
But they're right. We do try. We
Yeah.
try to keep you at home.
Yeah.
But you had to be somewhere, and then it comes
Yeah.
with a whole host of...
Yeah.
And at that age, you learned a lot.
Yeah.
You probably learned some good things, too.
Yeah.
But you probably learned some
Yeah, I
things.
met my best friend there. She's amazing. I love her.
Yeah.
She lives in Wisconsin, so far
I
away.
just did a series on keeping friends from recovery
really?
and the pros and cons.
We're able to have a healthy relationship, and I really appreciate
It
that.
takes work, doesn't it?
It does,
You have to work a little harder in those relationships.
Yeah. But ERC...
But you weren't recovered there. You said you left ERC.
Oh,
not
I
done
left.
Yet.
I left probably with... I was medically better and more stable. I was healthier physically, but I was not healthy. I think I was, in a sense, maybe even worse mentally.
Depressed, you mean? The
Yes.
depression, that hopelessness you
Yes.
described is still happening.
Yes.
So then do you come back to Ohio at that point?
So, yeah, so my team sits me down. They're like, hey, so, well, you're gonna get sent home. And I was like, I remember I held it together for them because I cared so deeply about them and I appreciated them so much. And as soon as I got sent to snack, we had snack after that, I remember feeling the need to eat my snack because I was like, oh my god, this means I'm recovered now. I need to eat this snack. So I sat there and I ate my chips and I was just bawling uncontrollably. I mean, I just lost it. I was so scared. I was like,
Scared
oh my
to
god.
leave the protection of,
I was scared.
ironically, that place.
Yeah, yeah. And I
Yeah.
was really scared for my future, and I felt like I didn't know my family because I hadn't seen them in so long, and I felt like I didn't know who they were. I hate to say this, but I felt like I didn't love them anymore because I just didn't know them. And
Your role had changed so much.
Yeah.
As a young person, you were this and then this and then this.
yeah,
You probably didn't know who you were.
yeah,
Is
I
that
really,
fair?
yeah.
Yeah, you probably took a long time to find yourself.
Yeah, definitely. And so I get sent home the day they tell me. My dad picks me up later that night. We stay at a hotel, and the next morning we fly back here. We drive from the airport all the way back. I get to see my sister. I give her the biggest hug. But yeah, it was very sudden, and I've never been good with change, but change that fast has been really hard. And so I came home and struggled for a very long time after with self-harm, other self-destructive behaviors, still struggling with food, but it was getting better.
Did they step you down to something here, though? Did you start with at least some version of the amount of support you were getting there?
I would have weekly appointments with Jen, which was my dietitian, and then I would.
Highland.
Oh yeah, she's great.
She is great.
I haven't seen them in forever because I'm doing so well now.
They don't need to.
Yeah,
That's okay. They miss you and don't miss you.
yes.
So you had a nutritionist, you had a therapist here, I assume.
Yes.
Did you go to support groups, any IOP? Did you do anything
Yeah,
to drop
so-
down from that huge setting?
At this point, I think, and I don't know, I think everyone was kind of like, we've gone through everything. What do we do? They were I think they were hopeless too.
Peer support.
Yeah.
I wish that was a thing.
Yeah,
Because we talked about
yeah.
you'd be a great peer supporter.
Yeah.
I don't know that was an option for
Yeah,
you back
no.
We weren't really doing it back then
Yeah.
as a eating disorder.
Yeah, but I would have weekly therapy appointments, weekly Dr. Rome appointments, weekly nutrition appointments, like psychology, like it was all of this
So you were
appointments.
keeping up, but also at some point, when do you get to go back to being a teenager? And like
Yeah.
go to live your life when you're spending all your time in these kind of rooms. That must have been tough too.
Yeah. Well, so 8th grade, I barely attended any school. It's been a whole journey with school as well because I have a hard time attending school, and now I'm doing much better.
What grade are you in?
I'm a junior.
You're a junior.
Yeah.
Okay. Oh, I said Hawkins. I can say that.
Yeah,
right?
you can
I
say that.
Why
Yeah, of
not?
course.
It's not protected
Yes.
information. You're in a good school.
Yes. So
So I see the ripples. I hear your story and I see all the amazing. I can tell you've come 900 miles.
Yeah.
But there's still ripples of stuff.
Yeah.
Like you had to work through the school stuff for a while
Yeah.
and the mood and everything else.
which actually reminds me, my mom gave me this ring. It's called Ride the Wave.
Oh, I love it. Little DBT.
Yeah, so I got that ring.
DBT wasn't the first to come up with Ride the Way. I think it was
Oh,
like Buddha.
I did DBT too. I completely forgot about that. I did like DBT, like family
course you did.
groups and all that.
Because I can tell you or your parents or your team was like, we're going to do this. And you,
Oh, yeah.
you followed every
Yeah.
protocol that you should have.
Yeah.
You and your family did everything right.
Yeah.
Your case is really intense.
Yeah.
And you're going to get to how it finally got better.
Yeah.
Maybe all of this accumulated at one point and like finally impacted
Yeah,
you.
so I honestly, I can't, I don't know how to say this enough because everyone was always like, when you get to that weight your body wants to be at, not necessarily what the weight that your doctors tell you need to be at, but when your body gets to that weight, it's like a light switch, like it flips on and off, and like when you get to that weight, it just flips on, recovery flips on. And I don't think it's based all on weight. I think it has a lot to do with your brain and how like you treat that, because eating disorders is not a weight disorder.
Right.
It's a mental health disorder. And
But the physiological side of it,
Yeah.
you're saying somehow informs the brain as well. And you felt
Yeah.
it. I love how you said that. You felt it just kind of switch a little bit.
it truly did. I started eating like more freely, and I took a break of appointments because I found that appointments were triggering for me because of the environment.
I'm glad you said that. Because
Yeah.
at that point, you probably just were like,
I
leave
was,
me all alone.
yeah, I
for
was
a
done.
minute.
And the
was done.
smell of the gowns I would change into for weights and vitals, it brought back psychiatric ward memories. And so
Good point.
it was just, I'm so sensory, like, sensitive. So, like, I'll smell
That's the
certain
ARFID.
things. Yes. I'll smell the certain things or taste something or hear something, and it'll bring me back.
I can't believe I didn't offer you my gigantic bin of fidgets under here. I have like, now we can't get to it because
Yeah.
my microphone will fall. But
It's okay. I fidget with my ring.
right,
Yeah.
I love that. I
Yeah.
love fidget jewelry too.
Yeah.
But so you had that memory of all of that. So you took a break. How long did you take a break for? Because I think I
Wow,
advise people to do
a
that.
long time. Like, I want to say... Oh, I mean, I just... Oh, okay. This is like... Wait, how do I describe this? I no longer have appointments. I didn't do therapy either, though. I took a break of that, which was actually really helpful. And it had nothing to do with the therapist, because I loved my therapist. He was great. But just to get a break of, like, the treatments and everything, it was, like, kind of...
Normalcy?
Yeah,
Were you looking
exactly.
for a little normalcy?
Yes.
Yeah.
Recently, though, I reached out and was like, hey, I'm in a place where I'm ready to work through my trauma from hospitals and my medical trauma and all of this trauma. I'm ready to do this. Can we start doing every other week appointments? And he was like, of course. And so I see him every other week now. We just started this. Like, we've only had one session so far after, like, a year away or something.
Is he an ED specialist? Or
Yeah,
more on the
Dean
mental health
Malik.
side? What's his name?
Dean Malik.
What practice does he work out of?
He works... Actually, I don't know, because I always saw him virtually, but I'm just going in
You
person.
have to connect us.
He's
after
with,
this.
what's her name? She's very well known.
Well, then if I don't know,
Something
it'll
with
be
a W.
embarrassing. You'll tell me afterwards.
Okay, I
Because
got
I'd love
you.
to connect.
Yeah,
But
yeah.
you said, I want to go back and do the stuff that it might very well haunt you down the road.
Oh, yeah.
As you develop or in your relationships
Yeah.
if you don't take care of it.
Yeah.
And you knew that.
Yes.
Yes.
So I was
Meanwhile,
like,
you were eating normal.
oh yeah,
Not over-exercising.
No. Yeah, it's like, I think for about, let's see, over a year. I mean, I haven't self-harmed in, I can't even remember when. It's been a really long time. And eating, I used to have such strict meal plans. I just eat whenever the heck I want. Like, I'll just eat whatever, whenever. It's like intuitive. Like, it's like whenever. Like, I'll just grab a snack, not feel, even, it's like, it's not that I don't, I mean, there's gonna be days where I have bad body image or I feel guilty about what I eat, but it's not like I go into this whole, like, oh, I'm gonna self-harm, I'm gonna go backwards, gonna hurt myself, gonna run away. Like, it's different how I handle the situations. It's different how I take care of myself. And I think that's kind of what recovery means to me, because I think recovery isn't necessarily that there's perfect days and you are 100% better, because I don't really think that's possible for anyone. I think recovery is kind of how you're able to learn how to take situations and use your coping skills and approach hard situations and get through them. I don't think it's like that you're never going to have hard situations. I think it's how you work through them, you know?
Well said.
Thank
because
you.
especially with an eating disorder, you might have a thought 10 years down the road.
Yeah.
But you might be able to be like, flick it off you
Yeah.
as opposed to like run with it and live with it.
Yeah, exactly.
So I love how you verse that. And that's true for so much.
Yeah,
It's not
it really is.
It's not linear.
Yeah, yeah.
So you have your moments, but you feel more capable in those moments.
Yeah, so it's been a while now, just like
How
living
long would
life.
you say since you've had behaviors? You mentioned that at the tail end of ERC back home, you said, leave me alone, people.
Mm-hmm.
How long has it been that you feel like you've been in recovery? Because at those treatment centers, you weren't in recovery. You
Yeah,
were still fighting.
Yeah. I would say it's been over a year.
That's what it sounds like.
Yeah. And I would say that when I look back at it, sometimes it does feel like it was like all of a sudden it happened, and in a way it kind of was, but in a way, if I look back at like all the hard work I put in beforehand, it really has been over a lot of time and like a lot of things that I had to do to get through it. And
I feel like it catches momentum. I tell people in the early stages, it's not going to feel like it, and you're going to do this and nothing's going to happen. And then all of a sudden, once you get a little momentum, and I think you were speaking to that, it started rolling.
Yeah, exactly.
To where you're doing intuitive eating.
Yeah.
Which after a year from what you've been through, some people may not be able to do.
Yeah.
They might still need to really follow structure. So props to you on that.
Thank you.
For real.
But yeah, it's been a journey, but it's like oh my gosh, in December I'm going to Denver because I want to visit Denver and actually go outside in the mountains, since I was never allowed outside, and I may visit ERC. And
I was going to say, are you going to visit?
Yeah.
Yeah. They do good work there. I mean, all these places do good work at different times for different people.
They do.
It's just not always the
It
right
was
setting.
hard because I was there during COVID. I didn't have, like, they were just all trying their best, and for so long I was like...
And they were in crisis.
Yeah, and for so long I was like, they did this wrong. Like, they hate me. They were trying to hurt me. They're literally engaging in abusive practices. And then I was like... It took me time, and I was like, even after I had recovered was in recovery from my eating disorder, I was still having this rigid thought of, like, they are bad. And it took me a lot of time, and then I began to realize, no, like, they were doing the best they could. We're kind of all doing the best we can in those situations. And it was a really hard time for me, but it was really, like, my choices impacted a lot of their choices, and not always in the best ways. Like, they had to make really hard choices to keep me alive. My Dr. Knopf, my psychiatrist at ERC, she said to my mom, like, if you weren't her mom, and if you didn't, like, allow us to do these treatments, if you didn't send her to these places, if you like were not as structured as you are, and as like she was harsh with my eating disorder, not with me, but with my eating disorder. And my mom said, she said, Dr. Knopf said, if you were not the mom that you were to Luisa, I truly do not think she would be here today. Like, she would not be alive with us today.
Because the parents suffer right along with you.
Yeah.
And they have to be just as strong.
Yeah.
And your parents were uniquely fit to
Yeah.
put up with that with
Yeah.
you, to put
Yeah.
it nicely.
Yeah.
And I love something else you said there. I love, and this is part of your recovery, and I can tell it's where you're at. You're letting stuff go.
Yeah.
You said, I could hate that place, and I could vilify him. Because when I talked to you when we first met, I thought, I wonder if she's going to rip on these places. But you have this beautiful viewpoint where you're like, you know what? It was what it is. It got me where I am.
Oh, yeah, I wouldn't have been able to get through without them.
And yet you can be an advocate, and I think you're going to be. That's why you're
Yeah.
here, too. For what could be done better.
Yeah.
Because no one will know that voice except for you, because you walked it. So I
Yeah.
can't speak to what you can. So you're going to make it better, but you're not letting it own you and making you angry and resentful.
Yeah, I was kind of went from sadness, and I was sad about it, and then it went to anger, and I was so angry about it. And now it's kind of been like, I feel a little proud. I'm like, I can accept and let go. And
It's like your signs of grief a little bit.
Yeah.
It kind of is the stages of grief.
Yeah.
Because you went through this process, and also grieving your eating disorder.
Yeah.
Because you kicked it to the side.
Yeah.
There.
And, I mean, yeah, it's definitely been a very long journey, but my dietitian...
For how young you started, yes.
My dietitian at ERC Denver taught me this metaphor, and it was about riding the wave reaching the shoreline. and you're stuck in the middle of the ocean and you're trying to swim to get to that shoreline where recovery is, and then the tide pulls you back, and it's kind of like how it's not linear. It's just all up and down and all over the place, and it's really hard, but I feel like I finally reached the shoreline, and that's like something I never thought I'd be able to say, let alone like I said this with the Nita walk. I truly did not think like going to that Nita walk was so much more than just like, I loved the experience of it, but it was also the pride that came with it. It was like, oh my gosh, like, I'm actually, like, not just surviving, I'm actually thriving. Like, I actually get to experience, I get to, like, because for so long I was like, I can survive, I can get through this, but I was never actually, like, enjoying life. And now life is so great. Like, I'm having, like, I feel so, I have those moments of like sadness, and I'm like, but then they turn into pride, and I'm like, oh, I got through that. Like, it was really hard, but I got through it. So oftentimes I find myself, when I have flashbacks or hard times or sad memories, it always ends up turning into like, oh my gosh, I did it. And I don't know how that's happened over the years, but it just has. And I think
it's the resilience, right?
Yeah.
You get to almost, just like you said, take pride and trust in yourself.
Yeah.
And I did some really tough-ass things. Check
Yeah.
me out. Makes you kind of mighty, in my opinion. Very
and
mighty.
It's like, 3 years ago I would have been like, or how many years ago was that? I've lost track. 11? Longer than 3.
It was 6 it started.
Wow,
And then you had 3 years where it was kind of not so great.
Yeah.
It sounds like 2 years of getting to where you are now.
Yeah, I think time.
If I followed the timeline
Yeah.
correctly.
I think sense of time for someone who has an eating disorder is very wacky.
Great thing to
Yeah,
add. Yes. How could you be connected to time with all that going on?
Yeah.
It's not like you're going up and getting to school every day.
Yeah, exactly. Yeah, it's interesting how I'll remember certain details of one event, but then not of like others.
And you were highly medicated. They were shooting you up with some benzos, I'm sure, to help you.
Yeah.
Settle down.
Yeah.
Well, and you mentioned that shoreline and that you made it there, and and you mentioned earlier sometimes we're gonna have moments.
Oh yeah.
But whatever you did to get to that shoreline, you get to keep forever.
Oh yeah.
So
I'm
if
not
you feel
going
like
back.
you take a little step and it gets a little sketchy, you're like, oh, I know how to do this.
Yeah.
I remember the path. It's right there.
Yeah.
It might look a little different.
Yeah.
But I feel like when you do what you've done, even if you start to struggle at times, it'll be quicker, stronger, and you're harder. You're more equipped to do what you got to do.
Yeah.
So I feel like it's a safe place to be like, whew,
Yeah.
especially at your young age.
It's definitely been
brain.
like, it's been like the whole journey, like after after I was kind of got through survival mode and was able to like take a breath, it's been very relieving and very like just kind of like, oh my gosh, like I made it. And I truly did not think I was gonna make it. I told myself I'm not gonna make it past 14 as a way of being like, you can't make it past 14. And then eventually when I made it to 14, I was like, oh my gosh, like I made it to 14, but I'm still not like happy. And then I eventually started working, and I got through it, and it took a lot of time. Like, recovery takes time. It is not a process. And, I mean, it's not a short process. And, I mean, everyone's journey with recovery is so different. I watch people come to ERC and leave within the first 3 weeks. It's so different, but
That's right.
it's still so hard for everyone in their own unique way. And I think that it's kind of something that even when you do feel those moments of hopelessness, you just have to keep fighting. And my friend told me this. She was like, in her goodbye letter, which I have a box full of all my ERC stuff, so I have a bunch of letters and all of that. She wrote in her goodbye letter to me the day I left, she said, I know you're not ready to go, but if you can't fight for yourself right now, do it for the people you love, and then eventually one day you will be able to fight for yourself. And that like opened my eyes, because I'm like, yes, you're supposed to do it for yourself. You're supposed to fight for yourself, but some people can't at that moment. Right. And so if you can't do it for yourself, maybe you can do it for the people you love, and with the support of the people you love.
Right. Eventually you'll get it.
And eventually you will. Because now I'm in the place where I'm doing it for myself. I'm fighting for myself, loving myself, getting through it because I want to get through it. And now I'm doing amazing things, like not just being recovered, but like advocating for recovery, or I'm going to be shadowing. I want to go into nursing or psychiatric nursing, so I'm doing this project with a nurse and shadowing hospitals. And so it's like, it's crazy how you can come so far, but you can come even further than you think you will ever be able to go. Like, I just thought I would make it out of this and live my life, but I'm living like my life to the fullest, you know? Like it's like you can go further than you expect yourself to be able
you
to.
got your life taken away from you for a
Yeah,
minute.
yeah.
So when it's stolen from you and you're in the restraining chair,
Yeah.
I bet when you come back out, you're like, oh, this is beautiful.
Yeah.
The vantage point that you have.
Mm-hmm.
And you can't get that unless you're low.
Yeah.
You can't feel that high.
Yeah.
So that's one of those gifts it's kind of like that toxic positivity that we try not to say in the beginning, but I'm kind of like, I'll look at clients and be like, oh, there's good stuff coming.
Yeah.
It's going to really suck along the way, but there's going to be something really good that no one can take from you.
Yeah.
I love that. Like, you get to keep this.
Yeah.
So you mentioned advocacy, and this is one of the things, is getting the word out. You went to the Needle Walk. How do you envision yourself being an advocate moving forward? What would you like to see yourself or other people like you doing to help improve our eating disorder awareness in situations?
That's a good question.
And you may not know the answers to these. I'm curious if you've thought about it.
Well, yeah, I have thought about it, and I think we kind of talked about this a little bit earlier, like, community groups within people who have gone through similar things, and that's kind of like the Needle Walk, where you get to, like, I love that, but I think something that's also really important, and we also touched on this, is treatments are always doing the best they can, but how can they, like, improve? Like, how can they do things that can even be even more beneficial or can really help the patients, not just in that time that they're in the treatments, but after they leave the treatment and after, because I know for me, I have PTSD from treatment centers, and that's been a whole other journey. So it's just like, I know my experience was quite different because it was during COVID, and I know I'm sure some of what they had to do was very different.
But a lot of people have been traumatized because of the care they needed.
Right,
so
exactly.
that part of it's not unusual. You might have had a very unusual type of trauma. So it's out there.
Yeah, but I think ways to bring awareness to it's complex because there's so many. Sharing your story with others can be triggering for some who are in the middle of their, like, trying to recover. And it's hard to know who you can share your story with. But I think that support groups with people who are sort of around, either have similar experiences in the sense that you were diagnosed at the same age, or you went through similar treatments, or something that you can relate to, would be really, really helpful. And I think that also you have to be in a place, though, where you're willing to accept the support of others to be able to be in a support group with people.
Yeah, you have to be at a certain, and that's the person that leads its job, is to make sure that you're all in kind of the right setting.
But then that's hard for the people who, like, aren't ready for that, you know? So it's like, it's a whole other thing.
So there's different levels.
There's different levels.
And I think you might even be someone that'd be good at some level, I'm not sure how we'd get this, to advocate at the level of the residential.
Yeah.
How do we do that a little bit better so people get closer to being open to, like, a support group setting?
Yeah.
And I mentioned the peer support because once you've had 2 full years of recovery, that's a chance to walk the path with someone with your lived experience, like the Needle Walk.
Yeah.
I think that's such a great opportunity.
Yeah.
I could see you doing that.
Yeah.
I could see you doing talks.
Yeah.
I'm
doing
about your experience.
something with school called spoken word, so we're going to be, like, practicing, like, speaking in front of others, and
you're very good
to...
at it. You got
Thank
no problem.
You. But yeah, it's definitely, I genuinely cannot put into words how amazing and beautiful recovery is. Like, it is something I could never. I think it's just something you just kind of have to. It's just a feeling. It's not really something you can describe. And
good, because you should have something special out of all this that I don't understand, or someone else who hasn't been down there.
And I think that feeling, honestly, I always used to tell myself, this is not worth it. Like, if I'm not going to get better, what's the point? Even if I do get better, I'm going to be traumatized from all this. It's not worth it. But this one feeling of, like, recovery and the beauty of it, that honestly has been worth all of that. Like, Just that itself has been worth all of everything that I've been through.
So you're kind of talking about faith in a way. For people to have the faith that thing you're talking about that you can't really, it's not concrete, you can't show, it's worth it.
It's so worth it.
It's there, trust that it's there. And that kind of, I guess it leans into a little bit of one of my last 2 questions, and the one is, you've given so much. I always say this, because is there another piece or a piece that you've already mentioned, a highlight of advice for someone on your recovery path? What is one of your favorite things to say to someone, or to highlight you've already said?
Oh my gosh.
You said so much. I feel like this entire interview is about that, but...
Yeah, let's see.
And that you might have just said it right there. Maybe that was it, that this recovery
there's
thing
definitely,
is there.
there's so many things I could say.
It's mean, because...
I remember there was this one time at ERC that my best friend I met there, she was just crying after she had had a force feeding experience. And I came up to her, And I started crying too. And I said, it just makes me so sad to like watch you go through this. It makes me so sad that we all have to go through this. And we just had this moment of like, we have to go through this. This is so hard. But it was also a moment of like, I remember after that conversation, we were like, we got this. We're going to get through this. Like, we will get through this together. And I guess you just kind of have to keep going. And I know that sucks to hear. And I know it's like, you're going to hear that and you're going to be like, oh, heck no, not listening to that. No, thank you. But it's something that, like, there's something so powerful about when you get to the other side and when you reach that shoreline that you just kind of have to keep going and pushing through. And those days where you push through, they're not going to be pleasant all the time, but some of them will be. And it's so up and down, but it's definitely worth it to keep pushing through. You got to keep pushing through.
And you're the person to look at someone and say, trust me.
Yeah. Oh, yeah.
It'll come out of nowhere. It'll come hard when it does, and it'll be totally different. And not done, but different.
It makes me so like, I don't even know the word when I'm trying to give someone, like I have friends who are in recovery, and I'm like, oh, I just wish I could put this into words and tell you like it's gonna get better. It really is. You gotta trust me on this. But I know they won't. I know they won't trust me because they're in a vulnerable state, and it's really hard. You can't trust someone when you're at that state. But
it's okay to tell them.
It is.
I know it's on the other side.
Yeah.
I mean, you gotta at least tell them that it's there. You can't see it.
And one day they'll experience it. You know, you just gotta keep pushing through. You gotta do it for yourself too.
Okay, this is the hard part.
Yeah.
And then we have to do a belief card. What's one word or two words to describe your recovery journey?
Ooh, okay. Oh, there's so many. Okay, one or two. Okay, let's.
Yeah. I used to say one. I'm like, no, you could pick two. What is something if you had to have a logo, I guess, with the one or two words on it?
Definitely empowering. That's been a big one.
Love it.
Because when I get to talk about my journey, it feels very empowering. And
I can feel that. It's like you're growing in your seat while you tell your story.
It makes me empowering, but also very proud. Very proud. Yeah. So
someone who's 11 and life looks really scary and they're struggling has empowerment and pride down the road, potentially. If that's two of their gifts. Yeah. You know, and that's something I don't think you would have ever believed if someone told you that was coming.
Yeah.
You'd be like, I'm going to be proud of this and empowered?
Yeah.
Did you tie me down?
Proud that I can, actually eat normally? No, I would be disgusted in myself for eating normally. No, you're going to be so proud. You're going to feel so proud. And my dietitian told me you got to, her favorite thing to say was, keep moving forward to reach that shoreline. Keep moving forward.
Even if it's a shit river on the way.
Yeah. Moving forward doesn't necessarily mean, it has to be perfect. Moving forward is when you get down or when something bad happens, you can get back up again and you can move forward from that hard time, and you can it's how you cope with those things, which kind of ties along into what I said about what recovery means to me, and how it's not going to be perfect. It's about how you handle it. It's about how you get through it. It's about
That's it. Yeah, because you don't get to predict what it's going to look like.
Yeah.
But you have, a different set. You have better equipment.
Yeah.
You have better oars.
Yeah.
You have water wings, maybe. You have other things to get to the other side, which you maybe didn't have.
Yeah.
So I just thought it would be interesting to do one of my little belief cards in the end. I don't know if it'll be relevant. Sometimes they are and sometimes they aren't. So if you pick one out, and then you have to open the little window, and let's see if it's anything that has meaning to you, and then we'll let you go because your poor mom's been waiting.
Ooh. What is now proved was once only imagined.
Oh.
That fits perfectly.
That's a little freaky. I didn't plan that. I have no control over that. That is freakishly close to your story.
Yeah.
And you get to keep that little card, too.
Wow, thank you.
That couldn't have been... So wait, read it to me one more time, because I love that fit.
What is now proved was once only imagined.
There it is.
Yeah. That's awesome.
So now you get a little token to
take
with you. Well, we've covered your intense journey, and we probably could do 6 more of these because there's so many offshoots.
Yeah, definitely.
Your sense of pride and empowerment with what your story, that's got to speak to people, and I hope that they listen and understand that it could look like it did for you 6 years ago. Yeah. And you could be sitting here today telling your story.
It's amazing.
Awesome. I appreciate your time. Thank you
for
being here.
Thank you for having me.
Let's see if I did it all right. Let me hit stop.
Thanks for listening to the Mental Health Spotlight Podcast, helping you hold hope on your recovery path.